Keeping up with today's fast-paced world can be difficult. Accelerate your life with iFiber Communications high-speed internet. Surf, stream, and game like never before. Give us a call at 509-754-2600 and find out more at ifiber.tv.
As far as Barry Kling knows, an average of 15 people die each year in Chelan and Douglas counties from a fatal drug overdose. But soon that data could become a lot more specific. Late last month, the Chelan-Douglas Health District ordered healthcare professionals in the two counties to track and report all drug overdoses they treat. That will help the district and the state of Washington keep better tabs on which drugs are being abused and by how many people.
What it boils down to is that it's not only a big problem, it's a broad problem. Almost every family is affected. And yet it's hard to get good numbers, especially on non-fatal overdoses. And as we do various things to try to improve the situation, and as physicians and dentists prescribe differently and the like, how are we going to know how well it's working if we don't have these numbers?
Life-threatening or fatal drug overdoses are now a notifiable condition, just like rabies, measles, and meningitis. That means healthcare workers from EMTs to doctors to even veterinarians must report an overdose to the health district once they've treated it. Beyond just deaths, the reporting, ordered by District Health Officer Dr. Francis Collins, will look at non-fatal overdoses, and not just opioids, which account for most of the OD deaths, but all drugs.
And the other thing that we keep hearing is that as prescription-grade opioids become harder to get because they're being prescribed more carefully, they become really expensive on the black market, and people are turning to heroin and in some cases meth, even though they're very different drugs. So those are anecdotal reports that we'd like to have more information on.
Since 2016, Washington has been in a declared state of emergency over opioid abuse. As part of that declaration, Governor Jay Inslee called for increased gathering of data to understand and combat the epidemic.
The reporting on any notifiable condition is imperfect, and we know that. But I think the high level of concern about this will help us get good data. You never get perfect data. When we know about one confirmed flu case, that probably represents 10 or 12 out there that we never hear about. So, you can't take it, you can't be simple-minded in interpreting it, but when you're measuring something in the same way year after year, the trends can be meaningful.
Jefferson Robbins, iFiber One News.